Your insertion point is at the midline. That means the tip should be at the midline. Using modified pen grasp, you apply short biting strokes, the tip third of the instrument, and wrist motion activation. You get to the line angle, stop, turn the instrument to move interproximal. At this point, you should see only the back of the instrument and not the side. Wrist motion activation can only be accomplished when all fingers in the grasp are touching. If you separate, you can only use digital motion activation. Using the tip third, you want to have directional pressure. You're pulling the instrument towards the tip and towards the tooth and rocking on your fulcrum. Your adaptation is tip third. That means you should see some space between the back of the instrument and the tooth. If the back of the instrument is this way, your tip is off the tooth. For the tip to go on the tooth, you must turn the instrument, roll the instrument so that tip third is on the tooth. Back is away from the tooth surface. Sometimes I see incorrect instrumentation where students are pulling the instrument out with their stroke. This is incorrect. Calculus, if it's present, is generally underneath the contact area. So you want your strokes to continue at least halfway across that interproximal surface. You also want directional pressure, so you're pulling towards the tooth surface, not just straight vertical this way, but actually towards the tooth surface. So if calculus is present, you will be successful in removing it. So you can see that directional pressure. You need moderate to firm pressure in your grasp. Pull the instrument towards the tooth, towards the tip. Wrist motion. To instrument the towards surface, you should sit at 9 o'clock. Make sure you have the correct working end. Your insertion point will still be the midline. Be cautious with your wrist motion. When you're on a facial surface, your wrist motion needs to come towards the tooth this way, so your handle is dropping down. When you get to the away surface interproximally, your wrist motion is now coming this direction. So you should always be coming towards the tooth surface that you're working on with your wrist motion. Remember, insert tip at the midline. This is a supra instrument, but remember that calculus typically goes a little bit sub, so you will need to plan to use the instrument a few millimeters subgingivally. Once you get to that line angle, you should stop, turn the instrument, you should see the instrument back, and you're now ready to move interproximal. Another thing you should look at is the angulation of the instrument. You want calculus removal to be at 70 to 80 degrees. That's base to tooth surface. 90 degrees looks like this, which means 70 to 80 is tilting the instrument towards the tooth slightly. 90 degrees, 70 to 80 degrees. This will help you to be successful with your stroke. Short biting strokes. Tip third,